federal government has reiterated its commitment to promoting sustainable nutrition activities in the country. Senator Ibrahim Hadejia, Deputy Chief of Staff to the President, Office of the Vice President, stated this at a news conference held at the Presidential Villa, Abuja. The news agency of Nigeria, NAN, reports that the briefing centered on the forthcoming high-level dialogue of faith leaders on nutrition in Nigeria, scheduled to hold on Tuesday, April 23. Hadejia stated that the Vice President, Kashim Shettima, who is the chairman of the National Council on Nutrition, was passionately committed to advancing initiatives that promote sustainable nutrition in the country.
Therefore, the upcoming high-level dialogue between the National Council on Nutrition and the faith leaders will provide a platform for strategic discussions and commitments towards sustainable nutrition investments for the benefit of all Nigerians. This event will bring together members of the National Council of Nutrition, state governors, ministers, development partners, and the highest apex bodies of faith and traditional institutions to establish effective and sustainable partnerships in nutrition advocacy and implementation. It represents a significant opportunity to align our efforts with the national agenda and the vision set forth by the Renewed Hope Agenda under the leadership of His Excellency President Bola Ahmed Tinubu.
Also, Dr. Ojuolakpe Sholanke, National Project Manager, Accelerating Nutrition Results in Nigeria, ANRIN project, said nutrition was one of the priorities of President Tinubu's administration, knowing how it relates to growth, development, and economic prosperity.
From the statistics available to Nigerian, about 37% of Nigerian children suffer from one form of chronic malnutrition, which is exemplified by stunting rate and micronutrient deficiencies. And this has been, also linked to the GDP of any nation. Nigeria loses close to about 11% of our GDP because of this critical loss of malnutrition. And it has been stated scientifically that the first 1,000 days of any child is important. And if we miss this window of opportunity to reach out to the vulnerable group of children that will really need this interventions that we're doing for malnutrition.
On her part, Dr. Zainab Muhammad-Idris, Project Coordinator, ANRIN Kaduna State, said faith actors have a role to play in ensuring that the right messages reached their followers, especially at the grassroots.
So we're working very closely with them, with our non-state actors, to ensure that the sermons that are delivered by our faith leaders reaches the population that are being served, and they use that, especially the scriptures, to ensure that the right messages that will lead to informed choices and informed decisions, so that the maternal, infant, and young child nutrition practices are improved across these locations.